Coming up, we'll be on location at Advanced ENT Specialists in Lansdowne, Virginia, discussing the latest advances in sinus treatment and how they can improve your sinuses and breathing with one of this region's top ENT physicians, Dr. Mahesh Parameswaran. Dr. Parameswaran is a board-certified physician and graduated from Duke University and completed his residency from Temple University Hospital. He is widely recognized as a top doctor within his specialty by Northern Virginia Magazine, among others. Welcome, Dr. Para. It's a pleasure having you on our program.
Thanks so much for having me, Rocco. I really appreciate having this opportunity.
Well, it's your first time, in fact, on the Top Docs report, and we have a lot to talk about. We've got some patients, from what I understand, that are going to be joining us a bit later. But I wanted to begin, Dr. Para. There are so many folks out there that suffer from various sinus problems and conditions. And I just wanted to ask you if you can please tell us what sinus surgery is, because I understand it's a very effective option in correcting a lot of those sinus problems.
Sure, I'd be happy to do so. So, sinus surgery is basically addressing the sinuses, and we have 4 sets of sinuses in our face, and the sinuses, drain through the nose, and they naturally create mucus, and they have to be what we call well aerated or have good air circulation within them, and that dictates how well we breathe. It dictates, potentially whether we're having issues with allergies and sinus issues. And the surgery aspect is that sometimes those drainage passageways, those areas where the sinuses are normally circulating air, become narrowed or blocked. And when that happens, patients are more prone or more susceptible to developing frequent infections. And if they've had enough infections that they're struggling and are on frequent antibiotics to treat those infections, then sinus surgery potentially becomes an option for them. And what sinus surgery is essentially focused on is opening up the natural drainage passageways of the sinuses, making them drain better, and that surgery is done entirely through the nose. There are no cuts or incisions on the face. The sinus areas are opened so that if there is a blockage, that blockage is relieved.
That's very good to know, because we've heard from a lot of folks and from some research prior to this filming with you, Doctor, is that a lot of folks not only suffer from these problems, but they have from sinus conditions which affect their breathing. I mean, you're talking about their whole quality of life in many cases.
That's true. I think a lot of people don't realize just how challenging sinus problems can be for the individual patient. A lot of patients do suffer. If you look at quality of life scores with regards to different medical conditions that are chronic, a lot of patients will say that their sinus problems are as debilitating as, say, heart disease.
Yes. Can you tell us a little bit more about how the sinus surgery is performed, Dr. Para?
Sure. So, usually sinus surgery is performed in an operating room setting. Essentially the patient is under general anesthesia. Okay. The surgery is performed entirely through the nose. We use lighted telescopes to look inside the nose and see, the surgical landmarks, if you will. And that allows us to peer into where the sinuses naturally drain. And then we use tiny instruments to basically widen those openings so that those sinuses can drain better and not be blocked all the time. Because when the sinuses are blocked, essentially patients are more of a setup for recurrent infection.
Yes. Okay. And this way it's eliminated and taken care of.
Right. So sinus surgery has the potential to have a very lasting impact for patients. Once the sinus openings are widened, what we see is that the lining of the nose and the lining of the sinuses essentially calms down. It becomes less inflamed, yes. And then the risk of recurrent infection is dramatically reduced. And so, long term, if surgery is done effectively and the proper sinuses are addressed, patients can potentially experience, an 85 to 90% relative cure rate with the surgery itself, and that can be lasting for a lifetime.
That's a significant number of successful outcomes.
That's true. That's true. I think when surgery is performed, sometimes the proper sinuses have to be addressed. So there are patients that require revision surgery. Sure. That may number about 10% or so of the population, and that may include patients who subsequently develop infections or problems in other sinuses that weren't surgically addressed initially. Other times, patients can have secondary issues in their nose related to what we term as nasal polyps, and those patients can certainly have greater challenges with sinus problems subsequent to surgery. And that's where we see some challenges with needing revisions.
Understood. And how long does it typically take, the surgery itself? And I preface that by saying, obviously, I'm sure it depends on each patient, how much work is involved, what you find. But in general terms, what is a patient looking at in time?
Sure. The surgery does vary based on the number of sinuses that are addressed. But typically it can last anywhere from about an hour to 2 hours.
Okay.
And as far as the surgery goes, some of the time also depends on whether there's a breathing component to the surgery. So I always try to break it down for patients. There's a sinus component to the surgery, which is focused on opening up those drainage passageways. There's a breathing component as well, which may relate to, for example, something called a deviated septum, or what we call turbinate hypertrophy. And these are structures inside the nose that can cause anatomical blockages, or basically narrow the space that we breathe through. So if those structures also need to be addressed under anesthesia, oftentimes that can all be done at one sitting or one anesthesia.
And I understand that can be done right here at your office, doctor? Or is it at the hospital?
Right. So the surgery itself is done in an operating room setting, usually either in an outpatient surgery center or at a hospital setting. Now, interestingly, you bring up this question of procedures that can be done in the office. And in the past few years, a newer technology has been developed called balloon sinuplasty. And what balloon sinuplasty is used to address is essentially widening those sinus drainage passageways without actually removing tissue. And essentially a balloon can be threaded into the sinus and then dilated. And what that can do is create a controlled opening of the sinus drainage passageways. Now the challenge is choosing the right patient for those types of surgeries. What we do here is, of course, evaluate the patient fully and try to determine candidacy for both office procedures as well as the potential for more advanced surgery in an operating room setting. And when it comes to balloon sinuplasty, that can certainly address sinus problems for a percentage of patients who suffer from chronic sinus problems.
Very interesting. And speaking of patients, who would you say would be a good candidate that can benefit from what you've talked about here today?
Sure. I think the key is making sure that the patient is obviously suffering enough to justify a surgery. Of course, surgery should always be approached with caution. There are always risks and benefits to surgery, and we want to make sure that the patient is really challenged with frequent sinus infections requiring frequent antibiotic use, patients who continue to have symptoms in between antibiotics. So if they're having a lot of symptoms of sinus pressure, potentially headache, significant drainage, fatigue, these are all taken into account because, again, we want to make sure that the patient's level of discomfort is enough to justify a surgical intervention.
Yes. No, that's a great point you just made, and that really helps clarify who is a good candidate and who isn't based on what you find when they come in for the consult and what they've been going through, and like you said, antibiotics and everything else. Now, what types of results can one see from the sinus surgery? What are we looking at?
Sure. Now that's
and I know you mentioned the 85 to 90% success rate a bit earlier, but can you tell us a little bit more about that?
Sure. I think there are a couple of ways in which we measure, shall we say, relative success after sinus surgery. I think one is that most patients will experience significantly improved breathing through their nose, just because the sinus areas that are inflamed are restricting airflow. So when you address those areas, the breathing improves. Certainly if we address a deviated septum, that too will also help patients breathe better. The next level of measurement is probably related to the frequent use of antibiotics. How often are patients getting infections subsequently.
Yeah.
And what we're trying to determine there is, are patients having infections as frequently? And so we would like to see, patients maybe on antibiotics far fewer times post-surgery. The only other variable that I think plays into this is, the other symptoms that patients commonly experience. Sinus infections won't necessarily present the same way. Patients don't usually have a severe pressure, headache-type symptoms. They may still have drainage, but they oftentimes don't feel as run down when they get a sinus infection.
Yes. We're now going to meet some patients of Dr. Para, an Advanced ENT Specialist. Welcome, Vic. It's a pleasure having you on our program.
Great to be here.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, Vic, I'd like to begin, if I may, by asking you if you can please tell us what brought you to Advanced ENT Specialists. What problem or problems were you experiencing?
Most of all, I was having a problem breathing out of the left side of my nose, and problems sleeping at night, and repeated sinus infections, 4 to 5 a year.
My goodness.
And that went on for a long time, years, probably over a decade. And my wife came here and she said, "You should see my ENT." So I came over and saw him.
So that's what brought you here.
Yep.
But those sounds like some major problems. I mean, you're talking about breathing and with the sinus. And
it was terrible.
So it must have been affecting you in many ways as far as your life goes.
Yes, definitely.
So what did you have done? You came here, you met Dr. Para.
Right.
What took place?
He examined me, did a CAT scan, and we looked at it together, and we decided to repair the left side, the deviated septum, shave the turbinates, open up the drain holes, so I would be able to breathe better through both sides of my nose. At night I'd have drainage, and that's what he did.
And how long did that take?
The surgery itself, gosh, I think the surgery took about an hour and a half.
Oh, okay.
Yes.
So you came for the consult, identified the problem,
Right.
The solution was recommended together, you and the doctor, and then you came back to have the surgery, which was about an hour and a half.
Probably an hour and a half. It was outpatient.
Oh, okay, wonderful. So then, how do you feel afterwards?
Fantastic. I've been, it's been 13 months since the surgery, and I'm probably had the healthiest year I've ever had. Haven't had one sinus infection. I can breathe at night. I can actually feel my nose and sinuses draining, and it's been fantastic.
You got your life back, right?
I got my life back. I can actually smell for the first time in probably 35 years.
My goodness. Well, that's wonderful.
Yeah,
We're
great.
so happy to hear that, Vic. And lastly, before I let you go, for all the folks out there watching, what would you tell them not only about your experience with Dr. Para, but also the staff here at Advanced ENT Specialists?
Oh, the whole experience has been fantastic. Great staff. Everybody's been so friendly, helpful, kind, and it's the best experience I've ever had with an ENT.
Well, on that note, I'd like to thank you for joining us, being a guest, and sharing some of your experiences with us.
Yeah, thank you.
It's our pleasure. Welcome, Joey. It's great having you on as well.
Thank you. Thank you for having me.
Now, I wanted to begin by asking you actually the same question that I began Vic's segment with, and that is, what problem or problems were you experiencing that brought you here to Advanced ENT Specialists?
I kept having constant sinus infections, hard to breathe through my sinuses, like I said, consistent infections, and I came for relief.
Those sound like significant problems indeed. That must have been affecting you in many ways.
Yes, it was.
And how long did you have that problem?
I had about a year. It's progressively gotten worse.
So it developed about a year or so back, was getting worse, obviously affecting your life significantly. So then you came here to Dr. Para, and what took place?
He did a sinus surgery on both the inner and the outer canals.
Oh, and how long did that take you?
It took about 2 hours of the surgery.
Okay. And it was an outpatient type of a procedure?
Right, right. I got to go home afterwards.
So what was the problem that he identified in your sinuses?
There was a buildup inside the sinus itself that constantly got infected. An infection was staying in that area.
So that was what was causing all that. And how do you feel today?
Great. I haven't had any sinus infections. I had it last July, and I have had I think I had one minor little flare-up, but other than that, it's been perfect the whole year.
And lastly, Joey, for the folks out there watching, what would you tell them about your experience with the staff here at Advanced ENT Specialists?
Well, it was awesome. I had actually gone to a different physician 2 years before and had this surgery, and it did not do that well. I'd gotten out of the surgery. I was in total pain for like a week before I ever left the house. It did not, for a better word, it did not take like it should have. So I came to Dr. Para this time, and his pre-surgery, starting antibiotics ahead of time, was not done the previous time. I went to a different physician. Oh. I believe that because of all the care pre-surgery, it was so much easier after surgery.
And on that note, Joey, I want to thank you as well for joining us, being a guest on our program. Welcome, Najuk. It's wonderful having you on our program.
Thank you. It's good to be here.
And again, thanks for coming down. I'm sure you're very busy, but we appreciate you coming down for a few minutes.
Absolutely.
And I wanted to begin by asking you, Najuk, basically what brought you to Dr. Para, an advanced ENT specialist? What problem or problems were you experiencing?
Sure. I had this persistent sinus issue that had been going on for about 5 years. And I had a surgery prior to this. I had a sinus polyp removal surgery.
Oh.
However, it wasn't successful.
And that was with another doctor?
That was with another doctor.
Okay.
And I was referred to Dr. Para by my primary care. And when I came here, he also noted that I had lost my sense of smell, and I could barely breathe from my nose. And I had constant postnasal drip because of the polyps and the other allergy-related issues.
So you had a number of things going on at the same time.
I did.
My goodness, must have made your life very, very difficult.
It was difficult.
So then what happened? You came to Dr. Para, and what happened?
Well, I came to Dr. Para, and after a few consultations, we decided that we would proceed with the polyp remover surgery because it was definitely necessary for me. I had polyps in all of the sinuses and the sinus cavities in my nose. And it's been about 4 weeks now since I've had the polyps removed, and it feels like I'm a newborn person, to be honest. I've regained my sense of smell. I can breathe. Even, in fact, the second day after surgery, I was breathing better than I was the 5 years that I had been breathing, or lack thereof, you know. So it was really a breath of fresh air, literally.
That's wonderful. Basically, you have your life back, right?
I do, yeah.
And this all started, you said, about 5 years ago is when these problems started?
Yes.
And then you just suffered. Poor thing, it must have been a rough stretch there.
It was, and you don't really appreciate the value of the breath, really, until, you know, for 5 years I was suffering quite a bit, so now it's just a relief.
Well, I take it you're obviously very pleased with the results.
I am extremely thrilled with the results. I have my life plans that I have been postponing for the past 3-4 years, and I'm extremely happy with Dr. Para's, whatever he's done is just a blessing.
That's great. And lastly, before I let you go, Najuk, as far as for the folks out there watching, what would you tell them about not only Dr. Para, but the staff here at Advanced ENT Specialists?
Well, I find that Dr. Para is extremely thorough, and I actually call him an artist because he's so focused and he's so dedicated to what he does. And I think it's the passion that he has for what he does that really resonates with the patients, and the results are in just the fact that my surgery was successful and how great I'm feeling after the fact. So I think that speaks for itself. And the staff here has been so accommodating and so adjusting and really patient with me. They've answered every phone call, and I've called a few times, and they've just been great. They're like a family.
Oh, that's wonderful, Najuk. And on that note, I'd like to thank you for joining us, sharing some of your experiences, and being a guest on our program.
My pleasure.
It was our pleasure. Thank you.
Thank you.
We're now back with Dr. Para. Patients seem very happy with the results. Some great work indeed.
You know, I'm fortunate to have some wonderful patients to take care of in Loudoun County. You know, obviously every patient's experiences are going to be different, but certainly I think sinus surgery, if chosen properly for a given patient, can be a real significant benefit for them.
Yes.
And so I think the key is choosing the patients wisely, those patients that are likely to succeed with surgery, making sure that they're having a significant level of disability prior to surgery is really important.
Yes, indeed. And we're literally out of time, Dr. Para, but I wanted to ask you, before I let you go, you and your practice, Advanced ENT Specialists here in Lansdowne, Virginia, Loudoun County, have certainly established a reputation for excellence. You are widely recognized as one of this entire region's top ENTs. I just wanted to ask you what you feel helps separate you and your practice apart from many of the others.
Sure. Well, I've been in practice now for about 12 years. 8 of those years have been in Loudoun County. And, I really enjoy doing sinus surgery and taking care of patients with all ENT-related problems. But sinus surgery has always been the area I like to focus on. Additionally, what I think separates our practice from other practices in the area is that we like to take a team approach. I always tell my patients I'm only as good as the people I surround myself with. And so I have a wonderful small staff here that's very patient-friendly and very patient-oriented. And we work as a team. And I think patients acknowledge that when they come to see us. They feel that we give a very personalized experience to the patient.
Yes, indeed. I mean, just the patients we interviewed today, they love all of you, not just you, but the whole staff, and you all treat them like family. I think that's very important in today's world where, unfortunately, you just don't see that with a lot of practices like it should be, but you all certainly have that instilled in your culture and how you treat all your patients, and it speaks for itself.
Oh, no, thanks for that. That's very nice of you to say. Thank you.
On that note, I'd like to thank you, Dr. Para, for joining us, educating us on sinus surgery and how it can benefit so many folks that are suffering out there with various sinus problems. And I'd love to have you back on in the future.
Thank you so much, Rocco. Thanks for letting me have this opportunity
Thank
today.
you. It was our pleasure.